Hello everyone. I'm Dr. HARKISHAN MAMTANI, Junior Resident from Department of Psychiatry, NIMHANS, Bengaluru from India. I'm here to present a poster that is titled Barriers of Vocational Rehabilitation in Adult Autism Spectrum Disorder, a case series from a tertiary mental health care institute in India. And my co-authors for the same are Dr. Kartik Singhai, Dr. Sujai Ramachandraiah, Dr. Deepak Jayarajan, and Dr. Krishna Prasad Muliyala. So much of the literature about autism spectrum disorder was earlier primarily focused on children. However, now it is known that the disability in functioning resulting from autism can persist even during adulthood as well. A recently published American study reported the prevalence of autism in adults to be as high as 2.21%. Large epidemiological studies for the prevalence of autism in India are lacking. However, the numbers are estimated to be in excess of 64 for every 10,000 population. It is also considered that the data for adults is even more underrepresented. Majority of the adults with autism continue to stay with family members or relatives beyond the age at which they are expected to function independently. Their involvement in school decreases beyond secondary schooling, and they also have been consistently shown to have high rates of unemployment or underemployment. Quality of life and overall functioning of an individual, which is determined by social participation, also seems to be disturbed in adults with autism. So these findings point towards their poor socio-occupational functioning and thus the need for development of efficient vocational rehabilitation services in this underserved population. For this study, we tried to ascertain the barriers faced during the rehabilitation of adults with autism by means of 4 cases who attended the psychiatric rehabilitation services at our hospital. After obtaining informed consent, we reviewed the records of these 4 patients and tried to elicit the various barriers faced during their vocational rehabilitation. So among our 4 patients, we had 2 males and 2 females respectively, all of who were in the age group of 21 to 30 years. All of them were educated till at least 7th grade, with 3 patients also receiving additional training. 2 of these patients had a diagnosis of Asperger's syndrome, whereas the other 2 had a diagnosis of childhood autism and pervasive developmental disorder unspecified respectively. Each of them had at least a single comorbid mental illness with unspecified non-organic psychosis and obsessive compulsive disorder, each affecting 3 among the patients described. 2 among these 4 had at least a single medical comorbidity with systemic hypertension affecting both of them. Now, coming to the barriers can be classified into autism-related barriers, comorbid mental illness-related barriers, caregiver-related barriers, and facility-related barriers. Among autism-related barriers, behavioral disturbances were found in 3 of the 4 patients, and social skills deficit was found in 2 of the 4 patients. Coming to the comorbid mental illness-related barriers, refractoriness of illness and borderline intelligence were perceived to be some of the challenges in rehabilitation. When we discuss the caregiver-related barriers, we can come across poor knowledge, attitude, and practices among the caregivers, negative expressed emotions, and discord between the primary caregivers, burnout in the primary caregivers, and reluctance towards vocational training as few of the barriers. Also, poor quality of facilities can be considered a significant barrier among the facility-related barriers. So as we can see, vocational rehabilitation in autism is an emerging area of research. Literature has listed out various barriers in this area, mainly interactional difficulties, cognitive dysfunction, behavioral issues, anxiety at workplace, and comorbid psychiatric symptoms have been identified as the major challenges. Other challenges include coordination of complex clinical care and service across systems, access to needed resources, services and support, management of independent living, lack of availability of autism-specific vocational training, communication challenges to convey the status of their physical mental health, and need for greater community awareness along with development of meaningful resources. So this case series of ours throws light on the various challenges faced by the patients, caregivers, and healthcare providers dealing with the vocational rehabilitation of adults with autism. Larger studies are needed to throw light on the barriers in the rehabilitation of this cohort. More studies with respect to vocational rehabilitation are required, especially for lower and middle income countries like India, so that appropriate interventions can be designed. I thank you all for your patient listening.